And this comes back to why are we teaching all of this? It's because low thyroid, whether you have hypothyroidism or whether you've been diagnosed with Hashimoto's, it's one of the most common diagnoses given to women, especially over the age of 40 in industrialized countries. I believe we're seeing an increase, and we're seeing so much of the diagnosis because of the mass exposure to chemicals, but also the mass consumption of gluten, coupled with highly processed foods, bad dietary choices, poor behavioral environmental factors, and that's leading to just a fundamental breakdown of the gland. And what most doctors' solution is they measure your TSH. If you go to an endocrinologist, they'll measure your TSH. They may measure your T3. They may measure your T4, not always. And sometimes they'll measure your antibodies on an initial visit. So this is the comprehensive blood work that you're going to get typically if you go to a regular doctor to assess your thyroid. And this is nowhere near comprehensive enough to assess anything. It's only measuring whether or not your TSH is within a certain range and whether these other things are within a certain range. But what about all these other variable things that we've talked about today, like the vitamin A and the vitamin D and the omega-3 and the vitamin C and the iodine, etc.? Your thyroid can't work, it can't perform, it can't be produced, you can't produce receptors, the receptors won't work, they won't bind well, the membranes around the cells won't work properly if you don't have these nutrients. But doctors aren't assessing any of these things. They're taking such an asinine, simplistic approach to assessing you. And then what's the answer? You have a low thyroid. It's genetic. You need to medicate for the rest of your life. Now, some would say, well, that's relatively benign. The medicine can't be all that bad for a person. What does it cost you to medicate for the rest of your life? And if the medication doesn't really help all of your symptoms that much, what does it cost you in quality of life for the rest of your life to have this hoisted upon your shoulders with kind of a fatalistic attitude of there's nothing that we can do? And it's not that there's nothing they can't do, it's that they're not doing it. And it's that they're not reading their own medical literature and they're not applying common sense science to their clinical practices. Now, I'm not saying that every endocrinologist or every doctor is guilty of this. I'm just simply saying that my experience has been vastly with women being gaslighted and being told this, and nobody's ever even bothered to check anything nutritionally ever about them. And so this list that you see here would be a way to assess much more accurately and give you more hope and give you more of a set of tools to empower yourself to make meaningful changes. So what are we talking about? Should you measure these things? Of course you should. These are kind of gold standard things that can be measured, and certainly they should be. So, get the regular testing, but there's also something called reverse T3 that you want to get tested for. Let me explain why real quick. So when you're converting T4 in your liver to T3, sometimes what will happen is your body won't do that very well, and instead it will make a substance called reverse T3. Reverse T3 is it's a stereometric, it's a mirror image of T3. So if T3 were looking in the mirror, it would see something that looked like reverse T3. But the problem with this is that T3 is active and reverse T3 is inactive. It has 1/1000th of the activity of regular T3. So if your body is making a lot of reverse T3, it's an indicator that your T4 is being used up to make something that doesn't really work very well. Remember what I said earlier is that this requires selenium and it also requires iron. And so if you're low in either one of these, you might be making too much reverse T3 and might not be making enough regular T3 or active T3. And so this test can be measured. It's a simple blood test. Your insurance will cover it. LabCorp and Quest Diagnostics, these major labs that are across the countries, will this test is in their battery of tests. It's not like if you ask your endocrinologist to run this test, it's not like pulling teeth. It's something they should be able to run relatively easy. Now, all of these things on this top list are tests that they should be able to run relatively easy. Again, that's these things here. Now, the rest of the tests, as we go down the rest of this, now you may be asking more than what they're capable, or not more than they're capable of doing, but more than they're comfortable doing. And this is where you have to find a good doctor. This is where you have to push and be your own advocate. But these are some additional tests that you really want to make sure that you're asking for. One is called an iodine loading test. And an iodine loading test is where your doctor gives you 50 milligrams of iodine to take, and then you collect your urine for 24 hours, and then you're measuring how much iodine of that 50 milligrams, how much of that iodine are you peeing out over the course of that 24 hours? Because if your body is saturated with iron, if your thyroid, and ladies, if your breast tissue is saturated with enough iodine, then if you take 50 milligrams, pretty much 90% of that 50 milligrams should be coming out in your urine. In other words, your body's saturated and doesn't need any more. And so an iodine loading test can really help you understand better your iodine levels. A good iodine loading test, though, will also measure the other halides. So it will measure the bromine and the fluoride to see if you're being over-brominated or over-fluoridated in any sense. And I can say I use this test as a kind of a standard test when I'm assessing someone's nutrition. And I probably see 1 in 2. About 50% of the people that I measure will have high fluoride. And it's because of their drinking water typically. Once we filter their water or change the water habit, their drinking water habits, and change their fluoridated toothpaste, generally that fluoride corrects. Then we also have testing called lymphocyte proliferation. This type of testing can measure all of these things over here. So all the nutrients, right? You can measure. We actually, if for those of you whose doctors won't do this, if you go visit Gluten-Free Society, we have this type of testing available direct to consumer, where we're actually measuring 55 different nutrients through this technology. And this is just a fantastic way to assess your overall nutritional status. Now, in addition, you should have your thyroid antibody testing done. This is also something that, just like these tests up here, can be ordered, and is typically ordered. It's not a big ask. But there's a few different kinds of antibodies. There's standard, there's something called TPO. TPO is thyroid peroxidase antibodies. And then there's another one called anti-thyroglobulin antibodies. Anti-thyroglobulin and TPO. These are the two primary antibodies associated with Hashimoto's thyroiditis. Now, if you suspect you have hyperthyroidism or Graves' disease, there's a different kind of antibody called TSI. That stands for thyroid stimulating immunoglobulin. And so it's basically a type of antibody that stimulates or behaves like thyroid. So it'll actually elevate your thyroid status, but it's a stimulating immunoglobulin. So again, that's more for Graves' hyperthyroidism versus Hashimoto's. So these two over here are more Hashimoto's. This one is Graves'. I would suggest that you ask your doctor to screen you for gluten sensitivity. Based on everything I showed you today, gluten sensitivity genetic screening. Again, if your doctor refuses to do that, this is another test that Gluten-Free Society offers, and you can go visit us there. I'll put some links below in the show notes for you if you want to check those out. You should be food allergy or sensitivity tested, because other foods can also trigger autoimmune thyroid reactions. Gluten is just the most well studied, but other foods can do it as well. And so rule out whether or not any other foods, because that's an easy thing to change. It's very easy to change your diet. Then chemical reactivity. So you can also have chemical immune response testing, where you're measuring to see whether you're reacting to certain chemicals. But the best case with chemicals is try to avoid them as much as you possibly can, whether or not your immune system is reacting to them, and just the best practice to avoid them. But you should also have heavy metal testing done. There's evidence now linking cadmium and lead to thyroid hormone dysfunction. And so, you know, if you're over the age of 50, you grew up in what we call the lead age, right? It was lead in the gasoline, there was lead in paint, there was lead in toys, there was lead solder in pipes. If you recall Flint, Michigan a few years ago, where all the lead toxicity was occurring and making people very, very sick, lead can contribute to poor thyroid function. We also know that mold and yeast overgrowth can contribute to thyroid hormone dysfunction as well, so it's not a bad idea to look at that. Part of how you assess mold is to also measure mycotoxins, which are the toxins that mold produces. And then we also know that abnormal gut bugs, gut bacteria, can contribute to thyroid problems through what we were talking about earlier with coffee, which is molecular mimicry. Some of these bacteria produce toxins, and some of these toxins they're called LPS, lipopolysaccharide toxins, that can mimic thyroid tissue. And so what will happen is your immune system will start to try to neutralize these toxins, and in the process of being exposed to those toxins, your immune system will look at your thyroid, and it will look at your thyroid because there's homology, because there's molecular mimicry between LPS and your thyroid. It may start attacking your thyroid in an autoimmune type of response. So sometimes people develop hypothyroidism as a result of having abnormal gut bacteria. And so again, these things can all be measured. And, you know, honestly, you should insist on the best. You should insist on the best investigation when you're visiting your endocrinologist. Your doctor has an obligation to serve you at a highest level by being investigative and not being dismissive, and to just simply run, you know, these simple tier tests and doom you to medicine for the rest of your life and tell you that diet and environment have nothing to do with thyroid disease and that it's simply genetic. That's where you need to look at maybe finding a different doctor and getting a second opinion. But I wouldn't settle for, you know, just these simplistic tests. Get a full evaluation so that you can ideally get off of medication, empower yourself to make meaningful changes in your diet and lifestyle. Now, when you do that, and if you do that, there's something else you need to be concerned about. And that's some of these symptoms. What I have seen happen in many folks is when they start making diet and lifestyle changes, when they start getting their nutrition deficiencies corrected, their thyroid starts working again. And, you know, whereas before it was broken, it wasn't working properly, or there was a breakdown in the way the thyroid was communicating to cells. And so when they made the meaningful diet and lifestyle changes, their thyroid started working again. And if they were taking medication, so this is for those of you who are on medication, when your thyroid starts working again, the medicine becomes too strong. And some of the common side effects of your thyroid medicine being too strong are hot flashes, heart palpitations, probably in my experience, one of the most common. Mood swings and irritability, agitation, angriness, right? This is especially true of women, really, really quick to temper. Trouble sleeping at night, trouble falling asleep and staying asleep at night. Restless leg syndrome, jumpy legs. Hair loss. Now, this is a symptom of low thyroid as well, right? And as well, anxiety. Usually these two kind of go hand in hand, as does here. So if you change your diet and you start supplementing and you're on a medication and you just all of a sudden you start developing these types of symptoms, the quickest I've ever seen it happen, I actually saw it happen in 48 hours. A woman called, she called my practice. 2 days after changing her diet, she went gluten-free and started taking iodine, and then started to develop these symptoms. And she actually called me from the emergency room. There was nothing wrong with her. They couldn't find a single thing wrong with her. In her case, her diet change and correction of iodine just made her thyroid medicine too strong. Now, not everybody has that quick of a turnaround, so don't expect that. Generally, as you're changing your diet and getting these things in order, this can take months to kind of start to happen, but I just don't want you to get months through this and start thinking, oh no, I have heart palpitations, I need to go see the cardiologist because I have a heart problem, when it could just very well be that your thyroid medicine's too strong. So if you're doing all these things, you really want to work with your doctor and you want to monitor every few months. You want to monitor your TSH, your T3, and your T4. You can also monitor, if you had thyroid antibodies, you can monitor your antibody levels. One of the things that we commonly see in people that make diet and lifestyle changes is their thyroid antibody levels start to plummet. I mean, I see cases where they're thousands off the chart and they'll come down. Within 6 months, they'll come down to below 100. So I know a lot of endocrinologists will say your antibodies don't matter. They do matter because it's one of the ways you can track the efficacy of your diet and your lifestyle change. It's one of the kind of the benchmarks that you can use. But again, back to my point, if your T3 and T4 are going up, if they're high, it could be an indication your medicine's now too strong. If your TSH is dropping less than 0.5, it's an indicator that your medicine is too strong. So again, you're looking for T3 and T4 to be too high. You're looking for your TSH to potentially be too low. Those are just clues or indicators that your medicine might be too strong. Again, you want to, if you're doing this, work with a good doctor to monitor these values so that when it's appropriate, you can potentially lower your medication and in a safe way without crashing or hitting the floor. So just want you guys to be aware of those issues. That's it for tonight. Look, thank you so much for tuning in. I hope you learned something new. If you did, do me a favor. We're trying to save 100 million lives. Please share this video with somebody you know or love or care about, especially if they're struggling with thyroid problems. And if you're new to the channel, make sure you hit that subscribe button and throw me a comment, hit a like. All those things help us reach more people, which is what this is all about. Thanks so much for tuning in. We'll see you in the next episode of Dr. Osborne's Zone.